Hello, my name is Vimbai. I'm an occupational therapist. I'm going to share with you what to expect when you fracture your hand. Fractures of the hand are usually caused by falling on an outstretched hand. I will talk about fractures in the metacarpal bones. These bones are between the wrist and the knuckles. This is a metacarpal bone. In this picture, it shows a fracture in the ring finger, the metacarpal bone of the ring finger. So when you fracture your hand, the orthopedic doctor will examine your hand and ask questions related to the nature of the injury of the hand. Questions and tests will include if you have any numbness, whether you can feel touch. This is to rule out of any nerve damage. An X-ray or a CT scan will be taken to assess and confirm the presence of a fracture. So in this case, there's a fracture in that ring finger on the metacarpal bone. A closed fracture occurs when the bone is broken and there is no open wound. Fractures are classified by the location of the break in the bone. I'm going to use phalanges to show the example of a fracture on a bone. If a fracture occurs in the middle of the bone, it's called a mid-shaft fracture. Like in that second finger, that's a mid-shaft fracture. They can also be classified as displaced or non-displaced. The top finger is a non-displaced fracture, and then the second one is displaced fracture. If more than two segments are produced, um, that means it's a comminuted fracture. Like on the left-hand corner, that's a comminuted fracture. So if the fracture involves many bone segments, it's called a comminuted fracture. Management of a fracture is determined by the nature of the fracture. A cast is used for non-displaced fractures, and application of a cast promotes healing of the bone. Displaced fractures can be put back in alignment, and a cast can be used to align the bone segments. Certain fractures cannot be treated by a cast. For example, a comminuted fracture, um, like in that left-hand corner, pins or metal plates can be used to align the bones. This is done under anesthesia. Following a fracture to the hand is the inflammation phase, which is marked by local pain, tenderness, and swelling. Clinicians will encourage the use of ice and elevation of the hand to reduce swelling. And within 2 weeks, pain is expected to decrease, as well as the swelling and the tenderness. X-rays will show a rubbery mass at the fracture site if taken after 2 weeks. Splints are used to immobilize the hand and to allow bones to heal. In A, the splint allows the person to be able to move their fingers, and it's put on top of the hand. And in C, the splint is under, and the person is not allowed to move their hand. And for about 4 to 6 weeks, the patient will have this splint on and is not supposed to get it wet. In adults, during the 4 to 6 week period, the splint can be discontinued or the cast can be removed. It has been known, though, that for patients who smoke and who have diabetes, there's an increase in time for the fractures to heal. The orthopedic doctor will order and guide treatment of what exercises to perform, and the patient is normally referred to an occupational therapist who guides them through these exercises. Usually motion in the hand is permitted and some strengthening exercises are allowed. Complications can occur, which include angulation of a metacarpal fracture resulting in pain with gripping, or scissoring of digits as shown in the picture due to malunion of the small finger metacarpal. Non-union occurs when the bone ends do not unite, and non-union can be managed by bone graft. And non-union is uncommon in the hand. The orthopedic doctor and the surgeon, with the client and the therapist, they work together to achieve the best outcomes. Mobilization must take place expediently to prevent contractures and adhesions, and the therapist checks for optimal fitting of the orthosis. So motion and limitations should not persist for more than 3 months. These are my references, and if you have any questions, feel free to ask me. I look forward to your questions. Thank you.